Fatigue. Fatigue may present with non-specific manifestations such as only fatigue, no organ or no disease-related manifestations. Non-organic causes of fatigue are psychological stress such as economical crisis or big loan or familial problem or excess work burden in the office, and depression, fibromyalgia, chronic fatigue syndrome. This all causes fatigue. Medication, beta blocker, steroid, alcohol excess, and chemotherapeutics. Cardiorespiratory problems such as COPD, CCF, bradycardia due to second-degree heart block or complete heart block or sick sinus syndrome, and postural drop due to diabetes mellitus or autonomic neuropathy due to any cause or in old age or due to drug induced. And then fatigue due to anemia. Anemia is the most commonest cause of fatigue. Leukemia, lymphoma, malignancy, and CKD. Endocrine disease, hypothyroidism, hypercalcemia due to any cause. Causes of hypercalcemia are primary hyperparathyroidism, hypervitaminosis D, and then multiple myeloma and few malignancies such as thyroid carcinoma, bronchogenic carcinoma, breast carcinoma, renal cell carcinoma, and prostatic carcinoma. This all causes hypercalcemia. Diabetes mellitus, Addison's disease, and hypopituitarism. Understand? These are the most commonest cause of fatigue. And then infection, chronic infections such as TB, infective endocarditis, hepatic problem, and autoimmune disease. These are another most common cause of fatigue. So hepatic disease is chronic liver disease, primary biliary cirrhosis, hemochromatosis, Wilson's disease, autoimmune hepatitis, and chronic disease such as SLE, systemic sclerosis, Sjogren's syndrome, and inflammatory bowel disease, malnutrition, malabsorption, systemic sclerosis. These all diseases causes fatigue. Now, investigation from fatigue in a patient with fatigue. Number one, you must do a CBC-PBF. CBC will show the evidence of chronic myeloid leukemia, chronic lymphocytic leukemia, acute leukemia, or anemia due to any cause such as hypochromic microcytic anemia, macrocytic anemia, or megaloblastic anemia, or hemolytic anemia. All clues you will get from CBC-PBF, and this is the single most valuable examination you must do, examination of anemia in any patient with fatigue, or at least in any patient. So I have given some investigation to find out the etiology of anemia, such as serum ferritin if microcytic hypochromic anemia, and hemoglobin electrophoresis, vitamin B12 and folic acid in case of macrocytic anemia, bone marrow study in case of aplastic anemia, endoscopy and colonoscopy for a patient with iron deficiency anemia, tissue transglutaminase and anti-endomysial antibody for celiac disease, and endoscopic biopsy of upper GIT or small bowel for celiac diseases. CRP is increased in infection and chronic disease, and ESR increased in almost all of the disease. And serum creatinine. If you find a patient with high serum creatinine, you do phosphate, in high phosphate, low calcium, low vitamin D3, small kidney on ultrasonography, anemia, and patient will have hypertension, vomiting, itching, malaise, etc. RBS, HbA1c, OGTT, FBS 2 hours after breakfast, sugar 2 hours after breakfast, or sugar 2 hours after 75 gram oral glucose tolerance test. This will help to diagnose the diabetes mellitus. Serum electrolyte, you must do it. Serum electrolyte when decrease sodium and increase potassium. That means low sodium, high potassium associated with hypotension, pigmentation, postural drop, you do short synactin test, short ACTH stimulation test, and if not available, 9 a.m. morning cortisol. It will be low in case of Addison's disease. Number 3, you must do a serum calcium. Serum calcium increase in bony metastasis such as breast carcinoma, lung carcinoma, thyroid carcinoma, prostate carcinoma, carcinoma of the kidney, and multiple myeloma. So if you find hypercalcemia, what you should do? The manifestations of hypercalcemia are constipation, renal stone, that is abdominal pain, polyuria, polydipsia, and fatigue. So investigation, you do serum M protein for multiple myeloma, X-ray of the skull for lytic lesion in multiple myeloma, chest X-ray for bronchogenic carcinoma, CT scan of the chest for bronchogenic carcinoma or breast carcinoma, staging, CT scan of the abdomen and pelvis for renal cell carcinoma and prostatic carcinoma, bone marrow examination, more than 10% plasma cell in case of multiple myeloma, serum parathyroid hormone, serum vitamin D3, and radioisotope bone scan for any evidence of metastasis in the bone. And then serum FT4 and TSH. TSH will be high, more than 5, and FT4 will be low in case of hypothyroidism, and anti-TPO antibody will be positive. The manifestation of hypothyroidism, weight gain, voice change, cold intolerance, constipation, and fatigue. Chest X-ray, ECG, Echo 2D, these are done for COPD and valvular heart disease or biventricular failure due to anemia, or to find out infective endocarditis, to find out infective endocarditis and heart failure. You do serum BNP in case of heart failure, Holter ECG monitoring in case of complete heart block, angiography and ETT in case of ischemic heart disease when patient present with exertional fatigue. Ultrasonography you do, it will show the evidence of CLD, small liver, splenomegaly and ascites, lymphoma, abdominal lymphadenopathy, ascites, only ascites in case, and mild splenomegaly in case of tuberculosis. It is also present in CLD and multiple hepatic metastasis in case of carcinoma. SGPT, SGOT and GGT for liver disease. If you find abnormality here, you do HbS-Ag, anti-HCV, serum ferritin, ceruloplasmin, alpha-1 antitrypsin, AMA, anti-mitochondrial antibody for primary biliary cirrhosis, and ANA, LKM, ASMA. These are done for autoimmune hepatitis, alpha-fetoprotein for hepatic malignancy, that means hepatocellular carcinoma. And then the biggest chapter is autoimmune disease. Many patients with autoimmune disease presents with fatigue initially, or many patient feels fatigue before the onset of actual disease in case of autoimmune disease. So RA, anti-CCP for rheumatoid arthritis, ANA for SLE, anti-centromere antibody for limited cutaneous systemic sclerosis, anti-Jo1 antibody for polymyositis, dermatomyositis, anti-LA antibody for Sjogren's syndrome, anti-RNP antibody for mixed connective tissue disorder, Pianka and Sianka for vasculitis, TTG and anti-endomysial antibody for celiac disease. And then endoscopy and colonoscopy for inflammatory bowel disease, celiac disease for small bowel biopsy, inflammatory iron deficiency anemia, and CLD for to see varix, and here only upper GI endoscopy is done. Echo color Doppler and blood culture for infective endocarditis, MT for sputum AFB done for tuberculosis. So this is the way of gathering knowledge about the fatigues in a patient with fatigue. You just only read this thing and find the manifestation to get in case of examination and taking history. Thank you.